Hey guys, it's Kristen here. I have Ehlers-Danlos syndrome for those of you who don't know me, and I am a licensed professional counselor. I'm not your counselor, but I am a counselor. I have been receiving a lot of comments about the medical gaslighting video that I recently did a while back. And I thought because of the volume of comments and messages on Instagram that I've been receiving, I wanted to further address it and maybe continue the conversation. So here's the rest of the story. For those of you who have not seen the previous video, I will link it below and you can go and watch that and see what that conversation was like. And I will try not to be too repetitive in this video about the things I said in that video. However, I do want to make some clarifications in case this is the only video you see. So let's get right into it. And please know that anything I say in this video is not professional advice given to you for you to take and care for yourself, but it's just to start a conversation and to acknowledge the fact that we need to be discussing medical gaslighting. It is not okay, and it happens way too often, especially for women, and especially with that bad word, pain. So, gaslighting, first of all, is not the exact same as medical gaslighting. Gaslighting is when a person uses a tactic to cause another person to question their reality, such as moving their keys, putting them somewhere else, and then telling them, no, your keys were never there. Didn't you set them there when you came in? Right? Causes them to once, no big deal. Oh yeah, I guess I did. 47 times? What's wrong with me? I can't remember anything. And then they start feeling like they're forgetting other things. So gaslighting is done with an effort to gain control over the person, or to have a sense of power over the person, to feel more powerful, or even to gain things like access to money or power of attorney or whatever, depending on the person. And it happens in relationships, like dating relationships or whatever, partnerships, where the one person will gaslight the other person into thinking and questioning their own thought process, their reality, and defer to the abusive person. Anyone is susceptible to gaslighting. This is not just a disability, elderly, gender biased thing, right? This is something that can happen to anyone. If you have any thoughts or any experiences, please don't share anything private you don't want to share. But if you have anything, whatever, about gaslighting, leave it below. I would love to talk a little bit about that, because it happens. And a lot of times, because it's so emotionally based abuse, it's hard to put your finger on what's actually happening, and it causes you to question if you are crazy, right? So a lot of times this type of emotional abuse is really hard to identify, and for the person experiencing it, it leaves you with a sense of wrongness, or you know something's not quite right, but it's really hard to identify what. So that's gaslighting. Medical gaslighting, however, is not in an effort generally to manipulate for power or control over a patient from a medical professional, but it is a manipulation tactic, whether it is intentional or unintentional, that a medical professional causes a patient to question their reality or sanity regarding their symptoms or the explanation of what's going on with them, or even as minor as inferring that the patient is exaggerating their experience. This causes patients more and prolonged pain. This puts their well-being and even possibly their life at risk. It decreases quality of life, emotional stability. It can create mental health issues where maybe there weren't any before. Unfortunately, medical gaslighting has proven in research to be most common in women and most common when dealing with pain. And this is not the exception. It's the rule, generally speaking. Medical gaslighting is mistreatment and neglect. There is no way around it. The consequences for medical gaslighting can be serious. It can be as minor as feeling frustrated, or it can be as major as not getting the care that you need to save your life. Oftentimes, people with chronic illnesses are accused of being hypochondriacs or drug seeking or attention seeking. That is another soapbox. Attention seeking, totally another conversation. So we'll just set that aside. But subsequently, either way, the results of this is not being heard. Doctors dismissing the conversations about what's going on in our bodies. And it's happened to me, and I know it's happened to you guys. I know this is not so uncommon that this conversation is in vain, because you've sent me messages. You've said, yes, I have experienced medical gaslighting. I did not know what the name of it was. I didn't know it was a thing. I thought it was me. It's not you. Not only do they dismiss your symptoms, or can dismiss your symptoms, it causes doctors or medical professionals to withhold treatment that could better your quality of life or even save it. Withholding treatment can cause your condition to get worse. Been there. If I had had the certain treatment that I needed years and years ago, then I would not have the complications that I currently have. I know you're out there. Many of you know exactly what I'm talking about. And this decreases quality of life for even years. It took years to get a diagnosis for me. And that's unnecessary, right? It takes one test to show Ehlers-Danlos. Okay, 2 tests, the Beighton scale, and then genetic testing. Okay, let's do it. If my insurance will cover it, let's do it. If my insurance won't cover it, let me pay for it, or let me decide. I think that's realistic. I think sometimes there are care choices, treatment options available, but for whatever reason, they're not offered because it's not life or death. But if it can increase your quality of life, why not give the patient the option to choose what they want to do with their body if it can improve their experience, potentially giving them back relationships, work opportunities, adventures, living life? We have one of those, and it's very short. So living it in pain or not well does not seem reasonable if there's care that can be given proactively rather than strictly giving palliative care. Okay, I probably should calm down. Whew, okay, I feel very passionately about this because it is so frustrating when proactive care creates quality of life. When palliative care addresses what's going on right now, we're going to put out the fire, but we could have avoided the fire starting to begin with if someone had listened and been willing to be proactive. Medical professionals make decisions for our bodies, and we live with the consequences. Think about that. So medical gaslighting can come in many, many forms. And I thought I would give you guys a few ideas or a few things that I hadn't mentioned in the previous video and kind of give you an example of each of those. So first, doctors sometimes, let me just say medical professionals, because it's more than doctors. Medical professionals can minimize the debilitating symptoms we present. And sometimes those symptoms are dangerous. Anybody heard your pain can't be that bad? Anybody out there with tummy issues when you haven't eaten anything for, say, 3 weeks, but you're able to drink protein shakes, so you keep your calorie count up and you keep your body going the best you can, and it doesn't alter your labs so much that the doctor's like, you seem fine to me. Tummy may hurt. Here's an antacid. No point in doing a scan because your weight hasn't changed and your labs are okay, but you're telling the doctor you haven't eaten in X amount of days. That is a neon flashing sign something is not right. Okay, that's the first one. Another one would be, I know you guys have heard this one, blaming symptoms on mental health issues or mental illness. I have personally been given cards. I am a therapist. I have been given cards for therapists saying, you know, I think this person is the person to help you with what you're sharing with us. And I take the card and think, oh, the answer. A therapist? Really? You do know what I do for a living, right? Not that therapists can't be blind to their own issues. Believe me, they can. Just like a cardiac doctor eats lots of bacon, whatever. But realistically, I'm pretty aware, just personally, me, I'm pretty self-aware. So a conversation is better than handing me a card and shoving me off somewhere, right? I think so. Conversations go a long way. Next would be assuming a specific diagnosis or why symptoms are what they are due to discriminatory factors such as gender, race, ethnicity, age, weight. I can't think of any others. Those factors should not be a reason a doctor makes a spot call, such as, I hear you, your feet hurt. Maybe you should lose weight. That will help. That's the answer. Maybe you should look at my feet. Okay, obviously I haven't had that experience, but I have known people who have had that experience, and not okay. Does it hurt a medical professional to run a test and be paid for it? If the results are nothing, then we've ruled something out. Sounds plausible. I don't know. That brings me to the next one. Refusing to order tests or imaging. I've been there. And I have had, say, I can think of one test that I didn't get, and another doctor had it emergency ordered because I requested it a few weeks prior to from another doctor. And the next doctor was like, we need to do this right now, and sent me straight from their office to imaging and then put me right into the hospital. And it could have been so much worse than what it was. And I was so grateful that somebody heard me and did a quick exam and was like, this is terrible. Go, don't even pass go, don't collect $200. Forget your hospital go bag, move it, sister. I was grateful. I was in the hospital like a week. That could have been avoided. I lost work, nerves, whatever. It could have been avoided. You guys know. One more would be actually refusing to discuss health issues, diagnoses, or symptoms or whatever because the patient has brought it up, and berating that patient for attempting to self-diagnose. Somebody's got to do it. If we don't feel heard, we have to turn somewhere. For me, oftentimes it's support groups before Google. But have you heard the sentence, who's the doctor here, me or Google? I have heard that word brought up in my doctor's appointments so many times it's inappropriate. Where'd you hear that? You've been Googling symptoms? Maybe I used Bing instead, or Yahoo. Maybe I didn't use Google. Anyway, so there's some examples. I wanted to talk to you guys just a little further about this. I hope this is helpful. You're not alone. Medical gaslighting is not okay. In the last video about this, I talked about a strategy I have employed. I am not encouraging you to do this, but I do want to share what I decided to do. And sometimes it takes radical decision making to get yourself in positions you need, because I am my only advocate. If anyone else advocates for me, it is a huge blessing of a bonus, but we have to be our number one advocates. Is that right or fair? Nope. But here we are. So like I mentioned before in the last video, I go into my doctor's. I always take a list of things I need to address. Things have really changed a lot. So now they like to give you 15 minutes and one issue per 15 minutes. And that's not really reasonable. I have 3 issues. Do I need to schedule 3 appointments in the same day? Can we do those, block them off back to back? Can I have 45 minutes of your time? And I know a lot of that has to do with insurance and billing. I get it. I don't even like dealing with insurance and billing in my own office. Ugh, I get it. But if a patient is there, how do we manage this? If I have 3 things going on, reality check, it happens. My body is so confused about how to be a body that it's not uncalled for. So what I do, take my list in and we start discussing things. And almost always one thing is effectively addressed and the other things are not. So then I will, at the end of the appointment, say, hey, I brought up these 2 things. Would you please, or are we going to address those? And if it's like, no, or next time, or let's see how this goes, which is the usual comment. Well, let's see how this goes and we'll talk about it next time. So then what I do is I say, awesome. So can you please put in my chart, in your notes from this appointment, that I shared these things with you and you will not be addressing this because whatever reason, you will not be addressing this issue. Thanks. Guess what? That usually makes a change. And I don't do it threateningly, and I'm not doing it to be threatening. I'm doing it to make sure there is note of me mentioning it and it being dismissed. Because in the past, I have had doctors say, you never mentioned that. I've looked through the notes. It's not there. So let's put it there. That way in the future, if I have an emergency and the comment is, well, you never mentioned it, we could have addressed this long ago. Oh, ma'am, sir, please look back. I did mention it on these dates and it's in the comments in your own typing, signed by you. So that's what I do, and it is effective for me. I would love to hear the strategies and tools you have found to combat medical gaslighting. So maybe some tips and tools can be helpful for all of us. I am so glad that you stopped by to further this conversation, and let's put medical gaslighting out there so that doctors and medical professionals who are overworked, I get it, they are overworked, but the reality is every patient's needs are equal to every other patient. And there is a right way and there is a unhelpful way to treat a patient. No matter your opinion on their diagnosis or their personality, that is irrelevant to their health issues. So let's cause the conversation to go a little further. Anyway, happy you guys are here. Please leave me a comment below and let me know your tips and tools and things that you have found to be most effective in addressing medical gaslighting. And if you're new here, let me hear from you. I'll see you next time. Bye.